you have an NGO which is being funded by world bodies and also Nigerian government tackling malaria. It's called Nigerian Interfaith Action Association. It's set up by NAREC. And NAREC is a body of 25 Muslim leaders and 25 Christian leaders, and that body is in Abuja. And I think that body is aimed at not just controlling malaria, but all other health issues. So I advise you to partner with that NIFA. We have an executive director who is a bishop. I urge you to partner with them also on such issues of health. I think that's the best advocacy thing we could do as religious leaders. So whatever meeting you plan, NAREC will fully come into it, because it involves both Christians and Muslims. This problem of maternal mortality is not just with the Muslims alone, or only in the north. There's so many, it's all over the country. And there are so many Christians also involved. So I think NIFA would be the best organ for you to partner when you are planning any interfaith conference on this issue. And I'm sure you will gladly work with you, and we assure you of our total support. I want to once more thank you and urge you to please continue enlightening people, because it's very important for our brothers to allow their wives have access to antenatal care. So it's very important. And we can only urge them as we've been doing, but we cannot force them, because we cannot reach out to all the nooks and corners of the country. Another important issue which I believe the government must fully come into is to have direct access to health clinics in all villages. Most of our villages don't even have a functioning clinic. So women with pregnancy-related issues or problems hardly get medical attention, because due to our nature of our roads, if there's any complication before the poor lady is brought down to Sokoto or somewhere, maybe she could have given up. But if we have these functional clinics where health experts could really attend to her as first line, like we used to say in military, first line medical facility, where she could just be given the first attention, I think it's very important. If talking of MDG's achievement by 2015 or thereabout, the state governments must fully come into it very strongly, because health issues are not things that you can just toy with. Because if you're not healthy, you can't even worship the Almighty God. And I believe in Sokoto, I know they've been working very hard, and I believe other states too. But it's an issue that you cannot just leave without keep on mentioning. But I know Nigeria is one country that you must always pursue things before you get results. And I think it's not a bad thing to continue pursuing such issues due to their importance. And I want to assure you, whenever you come up with any plan or a program where you want us to partner with you, we'll gladly lend our helping hand. There are issues that people misunderstand on religious lines. And the conferences like that, bringing ulama, bringing pastors, bringing other clergies to discuss such issues will really help. I know I organized a conference on girls' child education in Kaduna, October 2010. But so many people feel girls should not be allowed to go to school. And I said, well, if anybody knows who is Nana Asmao, the Danfordio's daughter, you know how scholarly she was. She had written books. And therefore, if you say, if she had not benefited from the knowledge of her parents and other people, how could she have written such books? So